You're watching the medical segment of the Jennylyn Show, and I'm Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in their fields of medicine. Today, Dr. Julie Chen, who specializes in integrative medicine and women's health, will be debunking medical myths associated with integrative medicine. Again, don't be surprised if some of what you have believed over the years are myths. Dr. Chen debunks myths associated with menopause and lots more. Stay tuned, she's very informative and has great tips for us, in addition to debunking the myths. Make sure that you know the facts and are not a believer of the myths. Here is Dr. Julie Chen.
Integrative medicine is utilizing conventional as well as complementary medicine to get the most optimal health outcome. So you want to use the philosophy of conventional medicine as well as all the other complementary alternative methods such as acupuncture, Ayurvedic medicine, homeopathy, etc., to kind of get a smorgasbord of various different health treatments so that you can get a patient to have optimal health outcome with the least amount of side effects and the most health benefits. Integrative medicine is a separate MD subspecialty in the field of medicine. It is a relatively young field. Just starting in 2012, there's this more formalized board certification process. And prior to that, a lot of people didn't necessarily have to do a fellowship before they took their board certification for integrative medicine. But starting 2012, there's more of a requirement that you have to do a fellowship, just like traditional fields like cardiology or endocrinology would be. You have to take a fellowship as well, and then you would do a board certification. And then this person would then be deemed an integrative physician. I think right now part of the problem is that a lot of alternative practitioners are using the word integrative practitioner, and so a lot of the conventional physicians have a hard time figuring out whether the patient should be going to an integrative practitioner because they don't know based on that name what the person's background training is. I think it'll be great once the board certification is uniform, that then it will help to promote integrative medicine as a field because other physicians would now be very comfortable saying, oh, when they're going to see an integrative physician, that person is fellowship trained and board certified, therefore it's less concerning for patients to be seeing these practitioners. A lot of the alternative practitioners do great what we call integrative care, or as much as they can within their knowledge field. But I think that being that most physicians like to see evidence-based medicine as far as therapies go, having that kind of formalized training and then board certification allows integrative medicine to be more formally utilized and more pervasively utilized by patients as well as physicians. And I think ultimately that will benefit patients as they look to try to use more supplements, natural forms for therapy, and then right now they don't have a lot of guidance. So later on, if they're able to see more integrative physicians per se, and their other physicians are more open to referring them, then you ultimately have more of a safe environment for patients to be using all these alternative forms. I became interested in integrative medicine when I was going through internal medicine training, and I did primary care for a while, and I noticed that a lot of patients have these non-specific symptoms, such as just generalized fatigue, but all their labs look great, they can't sleep, they feel like their hair is falling out, but their thyroid and everything looks great. And so a lot of these patients ended up getting sent to, by their other physicians to, psychiatry. They're saying that they're depressed, etc. But I felt very frustrated because I knew there were certain aspects to a patient that's not quite right, but our labs are not meant to pick up every little minutia. And so knowing that integrative medicine tends to look at a lot of disease states almost as though they're in that leaky faucet stage. So it's that early symptoms, and it may not even be to the point where labs will pick it up yet, because we do know, for example, diabetes takes years in the making, and prior to the labs being abnormal, there are going to be non-specific symptoms or no symptoms at all, and then the labs will pick up the abnormality. So integrative medicine for me was very interesting because it allows me to treat patient populations that are in that kind of watershed period of disease where they're not sick enough for medications, but they're not feeling quite right. And so A lot of these patients now, we're able to pick up things like adrenal fatigue. We look at things that, medication would be too strong for, or very subclinical low thyroid levels that, again, medications would not be appropriate. So we utilize a lot of fundamental building blocks like vitamins, minerals, herbs, et cetera, to give some support to the patients. For example, licorice is great for adrenal support, but, if someone is going to use that, they want to have physician guidance, because over long term, that can have some impact on your electrolytes like potassium and kidney function. So a lot of my patients will come in to see me for herbs and supplements for these kind of watershed medical issues that are too mild for medications, but enough that it hinders their daily life. So to me, integrative medicine is very important, because a lot of times I see patients where they come in almost at the precipice of severe disease. So for me, if I'm able to help bring them back with lifestyle changes, with just minerals and vitamins and herbs, a lot of them become really functional, and we never have to wait until they become a full-blown disease category estate before we start treating them. And so to me, understanding that aspect of integrative medicine, and I've always had a strong preference for looking at alternative things, vitamins, minerals, etc., diet. I have a lot of cousins who are nutritionists. So, you learn a lot about what all those different factors in life can help or hurt your life. And so integrative medicine allows me to really kind of focus in on helping patients revamp their health from all different perspectives. And so when I was doing internal medicine, when I was frustrated, I looked towards this subspecialty because it felt like I can really be more of a healer and not just a prescription writer. One of the great myths that I hear a lot from my patients when it comes to eating soy in their diet is they're always worried about the risk of breast cancer, hormone-associated cancers. And so there's a lot of literature out there, and so it's hard for patients to really kind of sift through all the information and come out with what's real. What the studies generally show is women who are younger, like early 20s, teens, etc., when they're eating servings of soy on a daily basis, that actually has some help with regulating your own hormone system. So young women who eat soy on a pretty regular basis, they actually see more of a protective effect long term as far as breast cancer is concerned. Having said that, women who are older, getting around the perimenopause period, when your body naturally is in a lower estrogen state, because as we get older, the production is lowered. That's a natural physiological state. And so when you have a woman who's in that period of their life, and then now they want to eat soy everything, soy milk, edamame, everything soy, and then now they have multiple servings, 5, 10 servings of soy a day. The problem is that soy is a phytoestrogen or a plant estrogen type. And so when your body is meant to be at a lower estrogen level and then you eat a lot of soy at that age, there is a concern that there may be some association potentially to increased breast cancer risk. So the usual recommendation that I have for my patients is that younger women, if they want to have some soy in their diet, that's actually recommended for them to have some protective effects, because their natural state as a younger woman is to have more estrogen, and the plant version of it helps to regulate a bit more. And then as you get older and you're in that menopause state, I usually will recommend that a woman have about 1 to 2 servings of soy a day. If they have very strong history of breast cancer in their family, or they themselves have breast cancer, I try to have them avoid soy altogether if they can. I see a lot of women in my clinic, and one of the most interesting things I hear a lot is women coming in saying they have hot flashes. They can be in their 20s, 30s, they can be getting hot flashes in their 40s, 50s, 60s, way past menopause. And they always, I think in the natural environment, we always associate hot flashes always just with hormones like the female hormones, the estrogen, progesterone. There is a possibility that the hot flashes or that feeling of heat or heat intolerance, because you get hot so easily, or feeling flushed, can be from other issues. Women who are taking medications like niaspan can get flushing from medications, from the niaspan. So that's something that you want to first look at, is look at your medications and see if there's anything in there that might be causing that. The other thing to keep in mind is that a lot of our other hormonal functions like the thyroid, our adrenals, if it's really out of whack and it's really imbalanced, a lot of women can have symptoms of that, including like if you have hyperthyroidism, which is overactive thyroids, you can have hot flashes associated with that. Ironically, I do have a lot of patients where they have almost like subclinical or low level thyroid functioning, and for some reason they're still having some hot flashes, especially if they have some adrenal dysfunction with it. So what I usually will caution patients is, when they come in and say they have hot flashes, I usually will check the gamut of their hormones. And I'll ask them for a history of their periods. Are you irregular if they're young? Do they have a lot of heavy bleeds? Do they have thyroid issue type symptoms? If they're older and they're going through menopause, we'll check their hormones, but also we'll check their thyroid and adrenal function, because as you get older, those other organal functioning also tends to start to poop out a little bit. So you really want to kind of look at the whole picture of the endocrine system altogether. One of the questions I always get in my clinic with women coming in heading around that perimenopause period is about hormone therapy, or should they do oral contraceptives, or what about bioidentical hormones, or should they do herbs like black cohosh or chasteberry for their symptoms. I generally am a much bigger fan of using natural forms first. I usually will see, because we have our adrenals, and the adrenals are these organs above our kidneys that have an impact on our hormonal system. And so if someone has adrenal fatigue or adrenal dysfunction, there's a chance that some of your hormonal functioning, as far as our sex hormones are concerned, are a little off balance, and you're a little less hardy in being able to balance it, purely based on that adrenal issue as well. So I'll check the gamut on the hormone levels for the adrenals, thyroid, and the sex hormones like progesterone and estrogen. But one of the things I look at are precursor molecules to some of the hormones like progesterone, like pregnenolone. Some of the DHEA is another hormone level that affects testosterone, etc. So I look at some of those precursor molecules and see if they're really, really deficient. And sometimes when you fix the precursor molecules like the pregnenolone, some of my patients' progesterones will improve. And that gives it a little bit of for us, a little more comfortable of an adjustment level without giving them straight progesterone or estrogen. Sometimes patients who have too much progesterone and estrogen from their supplementation, from their hormone replacement therapy, they start to actually feel worse because it's too much hormones in otherwise what should have been a lower hormone state in their time of their life. So I am a big proponent of looking at the body of just right. You don't want too much or too little of hormones or hormonal activity. So when it comes to adjusting hormones, one of the big things I look at is first you want to adjust slowly. I like to actually start low and titrate up slowly rather than give a big dose at the beginning and then now you've overloaded the patient and you have to titrate back. So because some patients tend to function better at a low normal level. Some patients will function better with a hormone level that's more mid-range or higher level. So when you tend to overshoot, you run the risk of making them uncomfortable and then having to push backwards. And so also I like starting slow and moving slowly upwards, titrating up slowly, because of the fact that, if we can get away with a lower dosage of replacement and their symptoms are much improved, not doing that higher dosage, for me, I feel safer because then there's that lower risk of having issues of hormonal cancers. So when patients are looking for hormonal therapy, one of the first things I usually recommend is let's check all of your endocrine system, thyroid, adrenals, looking at the precursor molecules, looking at the actual hormonal levels of progesterone and estradiol. And then we look at what options there are for that person to take for therapy. Because if their precursor molecules are super low, and sometimes if you raise that to a low normal level and then progesterone responds to that, that might be a good way to go. But if, let's say, the precursor molecules are adjusted and their levels for progesterone and estrogen are still really low and they're having symptoms of vaginal dryness, hot flashes, etc., mood issues, insomnia, then we really want to look at maybe targeting a little bit into the hormone progesterone and estrogen levels. The next step from that, I usually will start with things like wild yams. I'll look at, phytoestrogen, plant estrogen. In my clinical practice, I have a lot of very sensitive, physiologically body-sensitive patients, so they don't tolerate hormone therapy very well. So some of my patients actually respond very well to using plant estrogens like soy. So I'll start with something like that as well with patients. And then if they still need it, we'll look at bioidentical hormones. And I like a good balance between the two hormones. As far as I'm concerned in my clinic, I like to mimic normal physiology or normal body functioning as much as possible. And as you know, unfortunately, as we see more and more research in the different areas that's associated with complementary or alternative options, we learn more and more. And you know, I am not beyond saying that some supplements that we feel comfortable using right now, if research comes out and says it's not safe, I am definitely much more evidence-based and wanting to move towards looking at what that research shows. So I'm always trying to keep up with the research to make sure that the patients are getting safe supplementation or bioidentical hormones or conventional hormones if they need that.